All right. Yeah, as Larry mentioned, I run the policy department here at the Michael J. Fox Foundation. But one thing interesting about a position like mine is that pretty much my entire job has nothing to do with helping the foundation. Um, the work that I do doesn't bring money into the foundation. The work that I do doesn't advance particular foundation goals. Our department truly is here to focus on the Parkinson's community at large, because the issues that we work on are issues that impact the entire community. Whether it's the Hawaii Parkinson's Association or the, Houston area Parkinson's Society, the issues that we're working on, the goal is to benefit and help every Parkinson's patient. But beyond that, caregivers and providers as well, because, it's not, no disease operates in a vacuum. Here's my team. We've got myself, Brittany Meyer, who is Senior Associate Director of Public Policy. And she joined a prior call to talk about Paraquat, and I'll give some update on that as well. But so Brittany's portfolio is basically all things research related, which includes pushing for increases in federal research funding, research freedom that would involve things like use of stem cells, animals in research, things like that. And then an increasing part of her time and portfolio is focused on the environmental triggers of Parkinson's disease. Aaron is Associate Director of Public Policy. He's been with us for about 3 years. Brittany started about 6 months after I started, and I've been with the foundation for about 5 years. And a little further background, I was CEO of the Parkinson's Action Network, which previously did public policy for the community. But we made a decision. It made more sense to merge that function into the Fox Foundation. And Larry mentioned the Unified Parkinson's Advocacy Council. That was created to ensure that the unified voice that Pam represented would continue under the Fox Foundation. And in fact, we've got probably 3 or 4 times more organizations that are part of the UPAC than were part of Parkinson's Action Network. Anyway, so back to Aaron. Aaron, his focus is primarily on access to care issues, drug affordability, the Medicare program, anything related to access to care. His one research-related portfolio item is work on attempting to eliminate the barriers to research for medical cannabis. At one point, we probably had a liberal position on that. Our position hasn't changed, but now it is viewed as quite conservative. Our view is still that we don't know whether it works or not from a scientific standpoint, and the federal government continues to have barriers to researching cannabis. So our goal is to get those barriers eliminated, get cannabis research just like any other drug that comes to market, so that we can know things like delivery mechanism, dosage, strength, things like that. Sarah is our Associate Director of Grassroots Engagement, who is 150% time right now focused on the upcoming policy forum, which I'll talk about. That's next week. She was brought on to really juice up our grassroots program, which we call the Parkinson's Policy Network. So her primary goal is to engage grassroots advocates and then to, obviously put on that policy forum. So the 116th Congress, which ended in December of last year, we did, even with the coronavirus, we did have some successes. We ensured that we got full funding for the National Neurological Condition Surveillance System. For those who don't know what that is, Parkinson's Action Network had pushed for that for 10 years, and it was finally enacted in 2016. We were able to get it funded in 2018, and I've had it funded every year since. And the system picked Parkinson's and MS as the first 2 pilot diseases for this surveillance system. And the picture there is pre-COVID, obviously. Todd and I were in Atlanta for a PDIQ event, and we met with Admiral Bill McKenzie, who at the time was leading the surveillance system effort. Ultimately, the surveillance system should give us really strong prevalence numbers, something that we have not had before. And I'll talk a little bit about some state registries. Well, I can talk about it now real quick. We have a Parkinson's registry in California, which is the most robust one, and it's the largest state in the country, very diverse. Ultimately, the data collected in California, and then Nebraska and Utah also have registries, but all that state level data can flow into the national surveillance system. Surveillance system as enacted is basically just a prevalence, a system that will give us accurate prevalence numbers. But once the state data starts to flow into it, it will basically morph the Parkinson's surveillance system into more of a national registry. Again, in the last Congress, there were 3 bills introduced to ban Paraquat. One of them was a standalone bill by Nydia Velazquez of New York. And then that bill was copied and pasted into a much broader pesticide reform bill that then Congressman Tom Udall and Senator Tom Udall and current Congressman Joe Neguse introduced bills in the Senate and the House that would not only ban Paraquat, but it would really reform the pesticide system in the United States and shift our system into a more European style. In Europe, manufacturers have to prove that the chemical is safe for humans. In this country, that is not the standard, which is pretty, horrible. But that shift alone could do a huge amount to regulate and eliminate dangerous pesticides and other chemicals in our environment. The other success, and this has been bipartisan for many, many years. It's one of the few truly bipartisan things in this country. That is medical research funding under Democrats and Republicans, regardless of control, the House, Senate, and the White House have supported increases. And from fiscal years 2016 through 2020, there's been annual increases of over 5%. And for Parkinson's, between 2016 and 2019, we have actually seen a 40% increase in Parkinson's research funding. Most of that has come through the Alzheimer's disease and related dementia fund. So there's a lot more research into Parkinson's disease dementia at the federal level now. Additional successes we had pushed for, and then Senator John Tester of Montana and Representative Josh Harder of, I think, California, they both pushed amendments to the National Defense Bill to include Parkinsonisms in the VA list of illnesses linked to Agent Orange. So that was a major success. Mental health legislation to expand the number of providers under Medicare that can provide mental health services was voted out of committee in the House. That was the end of it. But we've got another push this year. And I think, because of the pandemic and all the mental health issues arising out of that, we're hopeful that a very comprehensive mental health bill can get through during this Congress. Telehealth, that's another major priority for Aaron from my team, but that obviously has really received a ton of attention and was a bit of a lifeline and lifesaver for the, for folks during the pandemic, and that has not ended. So we're hopeful. Right now, it's expanded telehealth is based on a national emergency order, a public health emergency, which continues into April. We expect it to be extended beyond that. But the one concern is that telehealth is not permanent. So we've been pushing with other groups to make it permanent. And our hope would be that because of the success of telehealth, that Congress and the administration will agree and make it permanent. And one of the hiccups with the current system, and we saw this where telehealth usage dramatically increased and then it's tapered off and actually gone down in some areas, is given that it's not permanent, there's not a signal being sent to providers that you actually need to invest in the technology and the talent to see patients virtually. it's not an inexpensive thing to do, and they don't want to make those investments if they don't think that they're going to be able to use it permanently and get reimbursed for it. I did touch base on the medical cannabis research issue. There was a bill that moved forward in both the House and the Senate. They passed the House and the Senate. Unfortunately, they were different bills, and they didn't have time to reconcile them. But it was the first time medical cannabis research legislation has moved through the House and the Senate. Additional engagement that was unanticipated as of 1 year ago today, but there were a lot of COVID-related issues that came up, and several of these actually were raised by members of the Unified Parkinson's Advocacy Council. So the UPAC really was helpful in identifying issues that we weren't necessarily aware of. One is the absentee ballot issue in the United States. Most states require some sort of a signature on absentee ballots. And as you all know, your ability to write and sign your name as Parkinson's advances changes. You know, that said, I mean, if you look at my signature 10 years ago versus today, you may not recognize it either. And I don't have Parkinson's. So the signature issue became a major issue because you could see the disenfranchisement of entire classes of people that have movement disorders, not just Parkinson's. So for that, given that in the United States, it's interesting that our federal elections are actually regulated at the state level. So the state sets the rules for the most part. So there is no federal absentee ballot system. It's state by state, sometimes county by county. So what we did there, given that, was we put together a blog detailing the issue, and we created an action alert that advocates could use to contact their state officials about this issue. There was also a gentleman in New Jersey, I believe, that was suing the state over it. So it did get some attention. It needs to be attended to further. We were a little discouraged after talking to one national disability organization because we really think it's a broader disability issue. And their take was, while they agreed with us, basically their biggest counter argument to these, bogus claims of election fraud and ballot harvesting and all that is that there is a signature requirement. So we got to figure something out, something different there. Another one, there's a lot of, and these first two here actually were in the news so much because of the politics, the election, absentee ballots, and delivery of those ballots. But for us, we got involved in the Postal Service, not because of the ballot issue, but because of the medication delivery issue. I believe the vast majority of people who get medications from the VA get it through the Postal Service. And so it's one thing if your Us magazine is delayed by a week, but if your medication is delayed by a week and you've run out, that can be a major issue. So we actually did jump in on that. Nursing homes became a major issue as we, as everybody knows, that the casualty and fatality rate at nursing homes was dramatically higher than anywhere else. And so we got engaged around there. And depending on, which study you look at, between 15 and 25% of all people with Parkinson's are in some sort of a long-term care facility. And so this became an urgent issue for us. Vaccine prioritization, we have gotten involved in that. Increasing numbers of people with Parkinson's have been, concerned that they're not on the lists for priority vaccination. We've again put together an alert and give this too, since in the US we didn't have a national vaccination plan. It too is a 50 state and sometimes county by county situation. So we put together a blog and an action alert that we pushed out and got quite a bit of traction from advocates urging their states to prioritize not just Parkinson's patients, but their caregivers as well, because it's kind of a team thing that has to happen. And then more recently, because we continue to get calls, the various UPAC members, we sent our own separate letter to governors of all 50 states urging them to prioritize people with Parkinson's. And many states have responded or had already announced that those with neurological conditions were being prioritized. But that was another, COVID-related effort that we got involved in. And then finally, we haven't had success with this, but as you can imagine, research has been stalled because of the pandemic. Labs were shut down, specimens were destroyed, lab animals, had to be, destroyed, things like that. So Congress has authorized money for NIH-funded research to, get some startup funds, which is great. We support that. But there are organizations like ours who, depending on which numbers you look at, we in 2020 may have funded more research than the federal government. Yet we don't have access to that pool of money for startup costs for our researchers. So Brittany from my team, working with the MS Society and some others, had put together an idea for bridge funding or research gap funding to help our grantees get some money. It might not necessarily a ton of money. It might be $3,000, $5,000, whatever. But just to help them bridge the gap to get their research restarted. Unfortunately, we haven't had success with that yet, but we'll see if in a future relief bill or something that we can get it in there. We're now in the 117th Congress. It was a rocky start for all of those who watch the news, but the House and the Senate have been seated now. It's a 50-50 split in the House, and it's a very slim Democratic margin in the Senate. So there is not a lot of room for error. But with that, some see it as, this is just going to be roadblocks and bottlenecks all along the way, which that may be true, but I think taking the optimistic view, it could result in actual accomplishments because members from both parties are up for election in 2022, and that's usually a big motivator to get things done. So, we could see some positive things happen, in the coming, year, after about a year, election season comes in and throws everything off. But the Congress recently passed, and the president just signed a massive $1.9 trillion COVID relief package. So that was their initial focus. One thing that existed in the olden days was something called earmarks, which is where members of Congress would put money in for projects in their district, specific money. And it was abused in the past, but the system had been reformed to make it more transparent. But in, I think, 2010, the Republicans banned earmarks for good reasons. It's not a partisan thing, but they felt that it just shouldn't exist. Well, part of the problem with that is, one, sometimes actual needs in members' congressional districts or states don't get the funding they need through the executive branch. And so it really disabled their ability to address local needs. And for example, I'm from Minnesota, and you might remember about a decade ago, this major bridge connecting two parts of Minneapolis collapsed when there were vehicles on the bridge, and there were several deaths because of that. Something like that would need an earmark. Well, that wouldn't need an earmark because of the tragedy. The Department of Transportation, I think, stepped in. But it could have been that bridge needed to be replaced, and they couldn't get the funding through normal channels because it didn't rise to whatever the levels are for the transportation funding system. So earmarks enable members to do that. The other thing they do is it's a useful tool when you're trying to count votes. If you can not slip, because it's transparent, people know which members of Congress are pushing for these things, but enables them to horse trade and put something in a bill that the member wants in order to get their vote. So there's that, but that is going to be coming back. So our focus in this current Congress is we've got a program at the U.S. Department of Defense studying Parkinson's research or Parkinson's disease. It's the only line item in the entire federal government for Parkinson's, and it's been around, for about 20 years. and it's funded a great deal of research, but initially it was a $25 million fund, and it got cut back to 16 million and has been flat funded for about 10 years. And so we're making our biggest push to date to get that back up to 25 million with an aspirational goal of getting it to 50 million. So that is our primary ask at the upcoming policy forum. We've also hired a outside government relations firm to help us with that. That and two other items that we're working with that firm on are what's called report language. What report language is with an appropriations bill that has all the dollar amounts for the spending, the committee approves a report to accompany that bill. And so the report language is where Congress gives suggestions to the agencies on where to spend the money. One of our efforts is to currently, a lot of the research in Parkinson's disease dementia only is funded upon the person having dementia. And it doesn't study the patient leading up to the onset of dementia, which makes no sense. So we've got report language urging NIH to prioritize, additional research related to PD dementia, but while the person has Parkinson's. So that's one piece. The other one is around the environment, where we have language in there urging the NIEHS, National Institute of Environmental Health Sciences, to prioritize Parkinson's disease, the environmental triggers, not just Paraquat, but heavy metals, rotenone, first responders, firefighters that are exposed to toxins that we aren't, because we're not running into 100-year-old burning buildings. And we actually had a meeting with the relatively new director of NIEHS a few months ago, and they were very enthusiastic about engaging more. And they actually looked at the report language, made suggestions that actually made it better. And so that language, we're very confident we'll get through. And then related to that, we have an ad hoc environmental work group internally with external experts. And we're working with that group to develop a environmental agenda for Parkinson's that we can propose to the NIEHS. So that's pretty exciting. Again, I mentioned the telehealth. We're going to continue to push that. Mental health, drug affordability. With the environment, I talked about the agency engagement. We're also looking for the Paraquat related legislation to be reintroduced soon. So once that's reintroduced, we will engage around that. And then, of course, expanding research and protecting research freedom. So with the new Biden administration, we were able to engage the transition team, prior to Mr. Biden taking office. And then after the president was inaugurated, we did get a meeting with his senior advisor, former Congressman Cedric Richmond. He's also the director of public engagement, so he's a high-level person in the White House. And he brought his team, including people from the Office of Management and Budget, to that call. I was part of it, as were Debbie Brooks and Michael J. Fox, co-founders of the foundation, and then Todd, our CEO. Had a really great call with them, talked about our funding priorities, which some of it, like one of our priorities is at the NIH, we urged a doubling of research funding at the NIH. But for Parkinson's, there is not a line item. So that's more of a, encourage the NIH to do more type of thing. And then I mentioned the DoD fund. We want to get that up to 50 million. We also, based on how many veterans have Parkinson's, it's a much higher percentage of people with Parkinson's that are members or former members of the military than the general population at large. And so while we do have a specific Parkinson's care effort within the VA system, they really have never been able to do research. So we are aspirationally calling for, and I say aspirationally because the VA is not quite ready yet, for a new $50 million research fund specifically for Parkinson's at the VA. And the other thing is, the United States is in forever wars, which means we continue to have a huge number of veterans coming into the pipeline. And, a lot of those folks won't get diagnosed for some time, but, it's important that we, take care of our veterans, and it's a great cohort to study. Some key connections within the administration. Pete Buttigieg has been now the Secretary of Transportation for a few months, or for not a few months, for about a month, I guess. He and Michael are connected personally. Michael had endorsed him for president, so we've got a real strong connection there, even though transportation policy isn't, really that big for the disease group. However, given that it's movement disorder, there could be transportation-related issues that could come up. But nonetheless, he's a great connection just to have within the administration. Dennis McDonough, the new Secretary of Veterans Affairs, he was President Obama's chief of staff and somebody I've known for 25 years. So we're very hopeful that we can move on some of the veterans issues with him in that position. I know there was some concern about why would you put a non-veteran in that agency. And in essence, the reason was Dennis is known as one of the hardest workers in Washington and takes unsolvable problems and solves them. And so he's, I think, a good pick from that standpoint, because there have been some intractable problems within the VA for years, spanning Democratic and Republican administrations. So I think there are a lot of hopes that, he's a get the job done. He's not a show horse. So we're hopeful that we can have a meaningful engagement with him. And then finally, Javier Becerra, I think still currently Attorney General of California, about to be finally confirmed as Secretary of Health and Human Services. He and former Congressman Jack Quinn, Republican of New York, who has Parkinson's, who actually just joined our board of directors last week. Jack and Mr. Becerra know each other from their days in Congress, so he's going to be a good connection as well. That being said, Becerra's first priority is, everything COVID related. So those are some good connections. The other thing we got are some grass tops connections, people that are directly connected to high level officials within the Biden White House or with the president himself. So, those are the connections we use at, certain times for certain reasons, when we've got something big. We're keeping an eye out on executive orders. He's been very active, more active than any other president in recent history, issuing executive orders. And there were a lot of regulatory issues that happened under the prior administration that we disagreed with, including something called a secret science rule, which would really disable the ability of the EPA to consider all scientific research studies before making decisions. So that's one of them. We had urged a ban on Paraquat, but the EPA did not ban it. So we're looking into options there. So there could be a lot of non-congressional action that we are engaged in. Then legislative healthcare priorities. Everybody hears about drug pricing. Prices are too high. Problem is, nobody really knows what the prices are, because the published price is not what the health plans pay, et cetera. So it's, with 1,200 or 2,000 health plans all making their own decisions on how to do that, it's pretty insurmountable to engage on that pricing side of it. But where we can engage around is on affordability, because bottom line is, whatever the price, the question is, can you afford it? And so we're focused on two pieces to address that. One is under Medicare Part D, there is no cap on out-of-pocket costs. And in the United States, about 90% of people with Parkinson's are on Medicare. Private health plans, they all have caps on out-of-pocket costs. So once you hit that cap, you're not on the hook for anything. That doesn't exist in Medicare, so we've been pushing for years to get a cap on out-of-pocket costs. And the other one here is what is called smoothing. And so that I don't have to do difficult math, if that out-of-pocket cost was capped at $6,000 a year, which sounds like a lot of money. But unfortunately, under our current system, if you are on an expensive drug that you have an expensive cost sharing to, you might have to have that $6,000 available to you January 1st, because by February 15th, you might have run through that $6,000. And not many people, have that kind of money just laying around. And so we are, again, in coalition with other groups, supporting something called smoothing, where you take that $6,000 and divide it up like a payment plan. So each month it would be $500, which is much more doable for people than having to have $6,000 in the bank on January 1st. $500 a month is still a lot, but at least it would create some certainty for people and financial planning. Both of those seem reasonable and sensible. The smoothing one, the complication there that we hear about is, well, what if somebody changes health plans? Well, that may not be as big of an issue under Medicare Part D, but I do think it's something that can be worked out. I think it'd be more difficult in the private sector plans to do that, because people can change plans because they change jobs or whatever it might be. Affordable Care Act, we're not deeply involved in that, but there is, there are efforts to modernize it. And as part of the COVID relief package that just passed, they did expand or they enriched the offer to the states to expand Medicaid, because many states still have not expanded Medicaid. And we actually do have a significant percentage of people with Parkinson's on Medicaid as well as Medicare. And so the goal there is to get more states to expand Medicaid. And then health disparities and access issues, both from a policy standpoint and as a foundation, we have an RFA, or we've actually got somebody doing essentially a lit review on all things related to diversity, equity, and inclusion, and gathering as much demographic information as possible. And she's also going to identify where the gaps are so that we can look at doing additional funding around those issues to learn more. Another element of that is social determinants of health, which have not been focused on nearly enough. But we're supporting legislation to expand efforts in that regard as well. We're also with new patient registries, really pushing to ensure that that type of data is part of it. Just real quick, our process, our three big buckets are to advance Parkinson's research, support therapy development and approval, and to protect and improve access to care. So those are kind of three buckets. Obviously, a bunch of other issues, come up on occasion. The tax reform bill of 2017, we were heavily engaged in because of some issues that could impact, Parkinson's. So we do get involved in some kind of random issues. And the Postal Service, is another one, but pretty much everything falls into these three buckets. We've already mentioned the UPAC, but that is a very important tool for us, as are all of you, in terms of identifying what the issues are that are impacting the community. We're a national or international organization, but we've got one office in New York and then the small office in DC. We're not out there in the 50 states. So we're not necessarily learning about the issues that are most important to people. So, we really rely on the UPAC, who are on the ground, to let us know those issues. We engage our patient council as well. We see them as another avenue to identify issues that are important to the community. But I see this group as another avenue for that. As I've said for years, we can think of wonderful things to do here sitting in Washington, D.C., but they may actually have zero impact on your life. And so, and it could be that the most important thing that we could do is a tweak of a Medicare regulation. And I think a lot of times people think we have to get an act of Congress, or we've got to get the president to do a signing ceremony. Most of what happens is behind the scenes, it's quiet. But sometimes a simple letter or conversation with an agency person to identify the issue, let them know what the problem is, because they cannot understand every aspect of every disease and the impact of what they're doing. And so as I say to people, it's not, I got a small team, we can't necessarily do everything, but we'd rather know about it so that we can watch for an opportunity. And just so you have it, our general email inbox is policy@michaeljfox.org. So if you do have ideas or issues that come up, feel free to send them in that way. We also collaborate not only with our own research team, but the various Parkinson's organizations that fund research and other advocacy groups to advance legislation and regulatory action. One thing about work at the federal level is we can get virtually nothing done all by ourselves. I mean, it's very difficult to accomplish anything. And so we have some formal coalitions we belong to. Oftentimes we have informal ones. One of the recent informal coalitions was actually around COVID, because we had been hearing about the Parkinsonisms being developed after somebody recovered from COVID, particularly one case in Israel that was studied quite a bit. We started to pay more attention to that. We had informally contacted the CDC and the NIH about it. But then we did put together a broader neurological conditions letter to the federal government, urging that they aggressively track and monitor over the long term the neurological impacts of COVID-19. And we did get responses from those two agencies, and they have set up such a tracking system. So that was an example of an informal coalition of roughly 35 groups that we pulled together. So that's really the best way to get things done. Then engaging the grassroots is critical. The patient voices are the ones that can make all the difference. Elected officials will listen to their constituents more than they will listen to us. And so whatever we're promoting, we need that army in the field backing us up. And that army are the patient voices, as well as caregivers and providers. To that end, the Parkinson's Policy Network I mentioned is our overall grassroots program. Even though 2020 wasn't the year that we had anticipated, literally days before the lockdown, we had a Researcher Hill Day with about 2.5 dozen researchers from around the country. And so this one was a specific research-focused Hill Day, where our researchers met with their members of Congress, focused on the needs for additional Parkinson's research funding. So it was very successful, and then everybody flew home and nobody left ever again. Everything being virtual, we did have in the United States during the month of August, it has traditionally been a month that Congress has left for the month and worked in their state or district. And the history behind it is Washington, D.C. is actually built on a swamp. You hear about drain the swamp. Well, they did drain the swamp, brought in a bunch of fill to expand the footprint of the city. But what that resulted in the depths of the heat in the summertime was unbearable heat and humidity in the chambers of Congress. This is all pre-air conditioning. And so they would take the month off. And they just continue to take that month off to have a month to work back. A lot of people call it a vacation, which is not true. I've worked for 2 members of Congress. August tends to be one of the busiest months because that's when you've got your elected official in the state, going around their district or their state. So we engage our advocates around that time frame too, to encourage them to get meetings, or in this case, virtual meetings with their elected officials. And then we had great activity. Actually, the last half of the year, our activity with action alerts and things like that, we saw dramatic increases in numbers of new people getting engaged. One alert toward the end of the year, I think it was like 64% of the people that took action had never taken an action on policy before. So that might be a side effect of the pandemic, that people are at home, they're paying more attention to stuff. It could be that the chaos of the US elections this year drove more people to get more involved. But whatever it is, we're very thankful that so many new people are coming into the policy realm. 2021 is underway. I already talked about the 117th Congress kickoff. We did, when they took office, we did launch a campaign among our advocates to welcome their new members, welcome the new members, and to re-welcome the old members. But it was just a great non-asking for anything opportunity to connect our advocates to the elected officials. Next month, we've got Parkinson's Awareness Month. We're thinking about doing a congressional briefing toward the end of the month. If we do, it'll be a virtual briefing that you all could attend. And then as part of the Parkinson's Policy Network, we have developed an ambassador program, which that's going to be for the people that are not just casually involved, but more deeply involved, that want to make a commitment to be an ambassador, to go through additional trainings. Essentially, we want to get them to the point that they are like a volunteer lobbyist, that they have developed these relationships. The ultimate goal is to get members of Congress to recognize, you as an advocate for Parkinson's, because you've attended town meetings or you've attended Zoom meetings, things like that. We want it to be that when that person is going to vote on an issue, even if they don't remember your name, they remember your face and they remember your story, because those personal stories are so critically important. As I mentioned, the policy forum is next week. Tomorrow is actually the last day to register for it. I think we're up to 760 people have registered for the forum, which is an all-time high, in part because in prior years, we could not invite the entire Parkinson's community. We had to limit it because it was in person. But because of this, we've been able to expand it to everybody. So, and we've got broad community support. We consider it a community event. As you can see in the title, it doesn't say the Michael J. Fox Foundation Policy Forum, it's the Parkinson's Policy Forum. And that's something that that we've insisted on because this isn't about us, it's about the community. So it starts next week, Monday through Wednesday. We've got programming in the afternoon. And then on Thursday is when we do the Hill meetings, and we've got over 200 advocates doing Hill meetings. This year, we couldn't accommodate 700 people to do Hill meetings, and not everybody wants to do them because it's their first step into this. And so most of the people are attending it for the first time, learning about the issues and the process and everything. So our hope is that in the future, when we do them, we can, probably do even more meetings with people on Capitol Hill. So that's been a great success. We've got great sponsorships from the community. I mentioned that we're targeting the appropriations around the Department of Defense program. We're also inviting people to join the Congressional Caucus on Parkinson's disease, and we have other leave behinds, but we and a lot of other groups, it sounds like this year, have decided to limit our congressional ask to a single item, as opposed to going in with a wish list of 4 or 5 things. Just knowing how distracted Congress is with COVID and other things, a lot of groups have decided to just kind of zero in on a single item and keep focus on that. So quickly, while we are 99% federal focused, we do engage occasionally on some state efforts. I will say it's opportunistic, meaning we're not looking for things to do, but if something comes to our attention that we could possibly help move forward, because there's essentially an inside game, then we're going to get involved. California, we've been involved with for years. In fact, because of the budget problems that they were anticipating, which didn't actually come to fruition, the Fox Foundation actually issued a grant to the state of California to keep the Parkinson's registry funded in this current fiscal year. The governor has fortunately put funding in for the next fiscal year, not enough to fund it at the full level, but we're going to continue to fund it so that we can actually make sure that the California registry is the most robust registry in the nation. We've got 2 bills introduced in Massachusetts. Again, that's more, it's opportunistic because we've got some well-placed legislators and advocates that are engaged on that. So we're hopeful on that one. Ohio is a great example of an advocate having a connection to a state legislator. And that state legislator reached out to the advocate because the state senator his uncle got diagnosed with Parkinson's and wanted to know what he could do. And so the advocate, his name is Ron Moore from Ohio, he reached out to me, put me in touch with the office. I had a model bill already to go. That's been introduced. Now we're just waiting to find out when they're going to have hearings and testimony and things like that. But so Ohio might enact a registry, and we're actually quite hopeful because the state senator has apparently done a lot of legwork with the governor and leadership and stuff. But that might happen. Again, it was opportunistic. But Ohio would be a great state. It's very industrialized, but it's also quite diverse. New York, what can I say about New York other than we're pausing on New York for the time being? But based on, again, Jack Quinn, the former congressman, his son is a former state assemblyman. So we had been talking about a strategy to try and get a registry in New York where the Fox Foundation is headquartered. But we were way too late in the game to try and get in the governor's budget, which is the primary mechanism to get things done in the state of New York. And so we're looking at possibly a strategy for next year, which by next year, it means starting this July to get it in the next year's budget. Every state is a different legislative process. It's different than the federal process. And so, that is also why we're opportunistic. We don't have a 50-state lobbying effort. I'd like to get there someday, but it's not yet. But we do want to take opportunities when they arise. We've also engaged occasionally on telemedicine related issues at the state level. And I know a couple of years ago, I think a Tennessee legislator had introduced a bill on medical cannabis that was pretty much identical to our position. So of course we did a lot of support. So occasionally we do, but we can't respond to everything at the state level that is out there. And then finally, Paraquat, when we had started the conversation a year ago with the California EPA about banning Paraquat. And then eventually they kind of said, hey, let's wait and see what the feds do, because if they ban it, then we don't have to. Well, the feds didn't ban it. So we are actually very engaged now with the state of California, EPA, and legislators about a possible ban there. And the strategy, at this point is next year in 2022, we've already identified legislators that are going to introduce a ban on Paraquat. In the meantime, Brittany from my team has helped to build, or has led the effort to build out a coalition of environmental and
Adepa, señor? Where Adepa?
Oh, somebody.
Adepa. Conoce Adepa cerca de Dolores? Sí, Adepa.
I think somebody's not on mute.
Dolores.
Anyway, so we've got a bill that's going to be introduced.
Christine, can you mute, please?
Sí, estás perdido.
Christine, can you mute? Thank you.
Okay, thank you. So we're pushing a ban in we will be pushing a ban in California and taking the time between now and then to build up broader public support and a possible campaign around it. But then, unbeknownst to us, the governor, it's now known to us, but the governor introduced as part of his budget a provision to tax chemicals based on their toxicity. And so the more toxic the chemical is, the higher the tax they're going to have to pay. And Paraquat is one of the most toxic chemicals. I mean, a couple of drops of it will kill you within hours. So that's pretty darn toxic. So we are formally supporting the governor's effort to impose this tax based on toxicity. But it's not just a tax for revenue purposes. The money will go toward recalibrating the farming system. The money will go toward helping farmers convert to non-Paraquat methods of farming. And that's the other thing we have to be realistic about. We can dream big on things like this, but there's farmers that rely on this for their livelihood. And some people will take and look at, okay, I might get Parkinson's in 20 years if I use this, but if I don't use it, I go broke and bankrupt next year and I can't provide for my family. And so we can't just be on our high horse and say, this is bad, which it is. but we need to support mechanisms to get them to switch to different farming practices. And on the federal level, in 2022, the Farm Bill comes up in the United States. And so Brittany's looking into that, about how can we use farm policy to incent farmers to no longer use Paraquat. So if we can't get an outright ban, we're looking at other avenues to essentially get the farming community to get to self-select to no longer use Paraquat. Of interest to this group, because a lot of you are not United States citizens and want engagement in your own countries. The World Health Organization is probably the best mechanism to try and have global impact. Myself, Todd, Rachel Dolan, our resident neurologists, are meeting with folks from the World Health Organization for two days in mid-April. Not the entire day, like 3 or 4 hour meetings. So it'll be my first engagement with the WHO, but I really do believe that the agenda that the PD Avengers has, that we have here in the United States, to take it global and impact in other countries, we really need the World Health Organization involved. So I mentioned policy at michaeljfox.org is our general email inbox. We can work together. I already talked about this in terms of engaging around the issues and you identifying issues that we should take a look at. Urge people to get involved with our Parkinson's Policy Network. Go to our webpage and sign up for policy alerts. And then I talked about the smoothing issue. So anybody in the United States, we have an action alert out to urge Congress to make medications more affordable through the out-of-pocket costs and the smoothing mechanism. So that's one action that can be taken right now, and we're continuing to push that out because that is very important to our community. And with that, I can stop sharing and take any questions.
Oh, Ted, that was great. Thank you so much. So much information. I know we have a couple of questions. Hugh had a question that he put in the chat. Hugh, do you want to ask your question?
Yeah, am I off mute?
Oh, there you go.
I'm really curious how much of the research money went to research projects on A beta and tau and dementias for Parkinson's dementia, but they're not really Parkinson's dementia, they're other dementias, and whether those dementia funds actually were used for people with that didn't have concurrent Alzheimer's and other dementias, but people who had synucleinopathies and dementias clearly related to Parkinson's.
That's a question I do not have an answer for, but I can share the link to the NIH website where you can run a report to get that type of detail.
Okay. And my second question is, see, I've been doing my numbers here while you've been talking. Based on what I've gotten off of Google here, almost 10% of veterans have a Parkinsonism.
Yeah.
In America.
Right.
Your lifetime risk in America of getting Parkinson's if you live to 89 is 6%. Only 1%. The average age is 89. So a couple, 3 or 4% make it that far. That's like the hazard ratio is well over 5.
Yeah.
Right. And that's why
that's got to be the biggest piece of data that proves that brain trauma and toxins really matter.
Oh, absolutely. And that's why we are putting a much more or a much higher priority around veterans related issues. Because those numbers are so off the charts by comparison to the general population. And even in the current Middle East wars, the burn pits are burning toxins, and there is a burn pit registry now where service members can voluntarily register. But what these burn pits are is they're in the middle of the desert, and the bases have to get rid of their garbage somehow, and so they go out in the desert, dig a hole, and start burning stuff. Well, there is something called wind. And sometimes the toxins that they're burning blow right back onto them because they haven't put the burn pits out far enough, things like that. So this is going to be not just an ongoing issue, but I feel is going to become a much bigger issue for this country because there's so many diseases that are coming out related to burn pits. We've been involved in that. But yeah, just the numbers alone, between 10 and 12% of Parkinson's patients served in the military. We're trying to get...
That's crazy. It's only 11 to 12 million Americans are veterans.
Yeah.
And yet it's 10% of all parkies.
Yep.
Yeah.
Yep.
That's nuts.
So what's interesting is tomorrow there is in Kentucky a panel that's convening to hear from veterans and Ray Dorsey because from the mid 50s to the late 1980s, Camp Lejeune had tainted water that they were giving the military and their families through the housing system that had TCE, the trichloroethylene in it, and other toxins. And they have what they believe is 1 million people have been affected by that tainted water over the course of that time, including like they have dead babies buried on in the graveyards. There's just thousands of people that have died from those toxins, and there's gonna be a reckoning this week. I suspect.
Yeah, and we've been involved in that issue as well in conversations with the VA and yeah, the Camp Lejeune. They did a few years ago created, I don't remember the exact numbers, but if you were based there for 12 months, I think, non-consecutive, didn't have to be consecutive, but for any 12 months during a window of about 20 years, that you were then eligible for service-connected disability for Parkinson's and several other illnesses. But yeah, you're right. That is one of the biggest debacles of our, well,
yeah,
of our federal government. We've got plenty of them, but that's one of them.
I want to go to Sabella, who had a question.
It was more of a comment about telehealth. I was supposed to have an appointment. I live in New York, here, clearly, picture. And I was supposed to have an appointment for telehealth. And I got a phone call for confirmation. And they said, your insurance doesn't cover telehealth visits anymore. So it's happening already. I did reach out to my insurance company to get a clarification. I'm still waiting for that. They said, we'll have to call you back because we cannot find that information easily. So that's, it's just an anecdote to illustrate one of the comments that you made. But thank you so much for all the information.
Yeah, well, and I think that's one of the reasons. Oftentimes what happens in this country is when Medicare does something, the commercial plans tend to follow suit, whether it's approving a new drug for a formulary or other types of policies. So making telehealth permanent, I think, is going to increase the pressures on all the commercial health plans to do it as well. I know a lot of the plans temporarily added a telehealth benefit during the pandemic, but as you're experiencing, they've eliminated it currently for reimbursement. So,
Hugh, you have a question? You're muted.
Yes, I do. This question is very respectful, Ted. We ask it of pretty much everybody we've ever done a strategic plan with. That's my background. And you've got a lot of balls up in the air. And you're pushing all the peas down the table. If you only had the ability to move 3 peas and get them to the end of the table and to hell with all the other peas, what 3 peas would they be?
That's a good question. Off the top of my head, I would, I think federal research investments would be, and have always been, kind of the highest priority. We need the federal government. They're the world's biggest funder of Parkinson's research. Depending on how you count it, we might be, but they need to do more. And that talking point should shame them into doing more, if nothing else. But so getting that federal research investment. Well, and we use this statistic. I mean, based on our economic burden study, the federal government, as of 2017, spends roughly $25 billion per year caring for people with Parkinson's, yet only $240 million researching Parkinson's. That's less than 1/10 of 1%. So that is a major problem. And, we need, and it just hasn't apparently gotten the level of attention needed. So that's the biggest P, is how do we ramp that story up? And that's, again, back to creating an army of advocates around the country. I think the environmental aspect is another one, because I do, not that there is anything, that truly is low-hanging fruit. But I think, and you mentioned Ray, it's Paraquat, it's rotenone, it's TCE, it's heavy metals, it's toxins that firefighters are exposed to. It seems like there is conceivably just a rich amount of environmental aspects to study, yet we haven't. I mean, we as a foundation have started to fund more in that regard, but NIEHS, I think they spend roughly $15 million a year studying Parkinson's related environmental issues. And so that one to me is just a no-brainer. The other thing is, we all can understand that. I mean, I'm not a PhD, I've got a law degree, but it's like, LARC2, tau, genetic this, microbiome that. I mean, most patients just frankly, don't understand the biology and stuff like that, but they do understand, oh, I lived in a certain area where there's a heavy concentration of people with Parkinson's, and it was right next door to this industrial center that produced XYZ. In fact, Jack Quinn, the gentleman I mentioned previously, former congressman from Buffalo, New York, but he has shared with me that, when he kind of mentally goes up and down the block that he grew up on, the number of people with Parkinson's is pretty amazing. And so why wouldn't we make a more concentrated effort in studying that type of, clusters and things like that? So again, off the top of my head, that's, P number 2. And P number 3, I suppose it would be around, care, access to care, ensuring that the Parkinson's community members are getting what they actually need. To that end, one thing I didn't mention in our White House meeting is that we also called for the creation of an Alzheimer's-like advisory council on Parkinson's, to ensure that there is interagency cooperation, but also to ensure that organizations that fund research like American Parkinson's Disease Association, Parkinson's Foundation, Michael J. Fox Foundation, that we too are at the table, so that we can have a more coordinated research funding strategy. In other words, so we're not duplicating stuff. It also would ensure that the federal government is talking amongst themselves, which you would think they would be, but they aren't necessarily. We're all taxpayers. We don't want our money wasted, spent twice on the same thing. But beyond the research paradigm, we also, that type of a council would focus on the care and services provided to patients and caregivers, because caregivers have a huge burden. They get burned out. They need respite. There's a lot more in federal policy that could go toward providing that kind of system, so that caregivers can get a few days off, or caregivers can have a respite. And there is a national respite program, but it's never been funded fully, so that there's barely the benefit is that it provides some grants to some states to help create kind of a central hub of caregiving resources, and respite care opportunities. But again, we don't have a comprehensive national approach on that.
So Ted, I've got a couple of little quick things for you, if you might take a quick note. Canada has 10 years of clean surveillance data for not only Parkinson's, but MS and Alzheimer's and all sorts of other stuff. So if you need a link to that, let me know.
Yeah.
based on that data and a bunch of other data, the average age of onset of Parkinson's is now around 75, including in the US.
Oh,
The baby boom, you're going to get slaughtered. You think it's going to grow based on your projections, and none of those projections include the updated average age of onset. The majority of people getting Parkinson's are well into their 70s and 80s. You're going to get killed. And with that, I'll shut up.
yeah, definitely share that link because, you know, as we, and I imagine the CDC is aware of it, but just in case they're not, it wouldn't hurt for me to have that link to the.
It's curated. It's exactly what you're doing and going to be setting up. And it comes from our provinces, the states, and it's clean data on medical records.
Okay, good.
Ted, on that council that they're proposing, like the Alzheimer's Council, but for Parkinson's, we'd love for you to advocate for a patient and a caregiver to be on that council. Yes,
and we have not presented it yet, but in the document that we've created, we do incorporate the patient and caregiver. Yeah,
great.
I think that's absolutely essential. Because like I said about, we can sit in Washington, come up with great ideas that may have zero impact on your life. You know,
right.
We don't know the experience. So it's critical that the patient voice and the caregiver voice is part of that.
Does anybody have any other questions for Ted? Yes, Gary.
Thanks, Larry. Hi, Ted. Thank you very much for an excellent presentation. Really appreciate it.
Absolutely.
I don't know whether this is for you or for Larry, actually, but I was struck by the stats that you presented in terms of the cost to the taxpayer of people with Parkinson's and the research budget of 0.1%. The equivalent in the UK is about 0.5%, so 3.2 billion and 15 million sterling invested in research. Do we have a view, firstly, on who the most progressive countries are in terms of their investment in research relative to taxpayer cost of the burden of Parkinson's? And secondly, do we have a view on how well the countries are actually working together in terms of the research budgets and making sure that it goes as far as possible?
I don't know who's the most progressive in that regard. And I honestly don't know how much the governments engage within themselves. I'm hoping that maybe when we meet with the World Health Organization, we'll learn something more on that. Yeah, and back to that statistic, what I didn't mention is the projection may be not accurate based on what Hugh just said, but the projection is that by 2037, which is only 16 years from now, the overall cost will rise to over $80 billion for the United States. It's currently roughly 52 billion, but of that 80 billion, about 40 billion of it is going to be a federal government expense. And you know, and we believe, you know, the projection that, you know, number of people with PD is going to double by 2040, you know, that may actually not, that may be too conservative in terms of the doubling, because we're living longer, more people are being diagnosed at a later age, as you mentioned, Hugh. So that 80 billion overall cost and 40 billion to the US government, you know, may be a conservative estimate. But those are the kind of numbers that do, you know, get lawmakers to pay attention. And you know, we've been talking about it. I think we do need to come up with a more juice in our strategy, shall we say, because we've been talking about those numbers, but we haven't gotten results yet. So we need to rethink that.
Hey, Ted, I think one of the things that you could do, because we don't explicitly say this, but like you mentioned, it's 17 years away till the 80 billion. It's, you know, it's what, 19 years away from 2040. Well, if the average age of onset is 75, that means there's, you know, 5 to 10 million people right now have Parkinson's. They just don't have the symptoms and they've not been diagnosed. They're alive today.
Yep.
For every Parkinson's patient, there's probably at least another in prodrome. And
Yeah.
for every one of both of them, there's a caregiver whose life is going to go off the rails.
Yes. Well, in this country, oftentimes we ignore a problem until it gets so big that we can't ignore it anymore. And that's unfortunate, but it seems like we tend to operate more in a crisis mode, at least at the federal level. I think states, you can they can be more responsive at times, but there are some things that only the federal government can do. And I know that with the red letter campaign, the call is for a tenfold increase, which would take it based on 2019 numbers from 240 million to 2.4 million, which would be a significant, not just a huge boost because it's tenfold, but then it would be almost 1% of what the government spends caring for people with Parkinson's. But that's not going to happen overnight. It didn't happen overnight with the Alzheimer's Fund, but it did happen over time. So as an aspirational goal, it's not unreasonable, and we just need to continue to push.
Yes, Gary.
Just to follow that up, 1% is the same figure that we're pushing for in the UK as well. So the GDNF participant group have put a petition in that's aiming to push for 1%. So interesting, we came up with the same number.
Yeah. Ted, while we were talking and you were referring to the costs, I had a file up that it said that the vast majority of the cost of care for Parkinson's in the US is not borne by the private system at all. It's borne by Medicare and Medicaid.
Right.
And so the private system really doesn't have a vote.
No, that's just it. That study that we conducted showed that 90% of people are on Medicare. It didn't really identify how many were on Medicaid, but an earlier study showed that about a third of people were on both Medicare and Medicaid. So the other cost is borne by state and local governments. It's borne by caregivers and the patient through lost wages, and a variety of other factors. So
bet you your legislators don't know that.
No.
That they can ignore private medical.
Yeah. Well, we do have one-pagers for each of the 50 states that highlights the data based on their state, how many people have estimated to have Parkinson's, what the economic burden for their state is. And that has been helpful. I mean, when I'm in California saying that you've got nearly a $4.4 billion economic burden based on the population with this disease. Now, I do clarify that half of that is covered by the federal government and the other half isn't just the state government, but nonetheless, there's a massive burden. They should pay attention to.
For sure. There is a link now in the chat from Jane. Thank you, Jane, for the UK petition. So if you want to sign that, you can. Also, Christine asked about our plan for WHO. I know it's kind of the first, this is the first foray next month with the Michael J. Fox Foundation. I know the 4 authors of Ending Parkinson's Disease is either in that meeting or in another meeting with them next month. And I've asked to attend as well. I think Amatola is speaking to the WHO next month as well. So we are well on our way. It's the first steps, and hopefully we get some direction on how we can collectively begin to campaign them for more attention on Parkinson's disease. So I hope that answers your question, Christine. And now her mic's off. Does anybody else, one more for you, Chris? Oh, you okay, Hugh did that. Any other questions? Jennifer, do you have any questions? Sonia, Julia, Sally, you good? Tim?
I have a quick one, actually.
Okay.
You mentioned, Ted, that the pandemic has really set us back a little bit in terms of some of the research studies needing to destroy animals or specimens and the gap research funding that you're looking for. Do we have any stats on how much of a setback we've had due to the pandemic when it comes to the research funded by the Fox Foundation, at least?
I don't have anything off the top of my head. And I don't know if we've got numbers like that. I do know that, we fortunately didn't take the hit that we were expecting in 2020 financially. So we've been able to continue a very robust, research funding pipeline. So it could be that our grantees haven't been affected like other grantees of other organizations. Because when we first came up with this concept, we were projecting like a 40% decrease in revenues and things like that, which ended up not being as bad. So I don't know that we've actually quantified it or have heard of much of a problem. But when this pandemic got, rolling, March and April, that's when we started to work on this bridge the gap concept. But in the end, it may not have been necessary for our grantees because I've not heard about significant problems.
Okay, it's good to know. Thank you.
Jennifer, did I see that you had a question that you were going to jump in with? No? Okay, how about Kat? You good? All right, Hugh, you haven't said anything yet today. You want to?
What a big loudmouth I am. By the way, Ted, if anybody in your staff wants a tour through the chronic disease data, I'd be happy to give them one.
Okay, thank you.
Okay, Gary, any more? All right, Tim, Sabella, Jane, Christine. All right, Ted, thank you so much. We really appreciate your help and guidance in this area. I mean, this is what you're doing is a tough slog, and we've got your back. So whenever you need our help, you let us know. We'll be there for you.
Yeah, no, I appreciate it. Thank you. And I've added Larry to. I do a monthly update, both internally and for the UPAC. I've added Larry to that email so that he can
Great.
forward it on to all of you as well. So, and I think Larry has shared that 2020 accomplishments document.
Yeah, I think you did. Yeah.
Yeah, feel free to share that because it
Great.
gives you, a full picture of everything we've been working on. And
Perfect.
yeah, I mean, we wish we could get more done more quickly, but we do the best we can. And again, the patient voice is the most critical one, for us to do our jobs from a policy standpoint.
That's
So
great.
thanks for having